Welcome to huevoicesdotcom. I'm your host, the People's Pen, Bobby Marvin. Today I have with me Dr. Gregory Branch, Health Officer and Director of Baltimore County Health Department. How you doing today, sir?
I'm doing well.
That's good. That's good. As good as you're doing well.
That's right.
Sir, in your profession, you're already familiar with the different disparities that threatens the African American community as far as health. Can you please elaborate on that?
I think that health disparities are a problem that we have with different groups, not only with African Americans. We have health disparities when it comes to men versus females. We come to health disparities when it comes to majority versus minority. So in essence, health disparities is something that affects and plagues multiple different groups, many minority groups. Now in Baltimore and the DC area, we talk about a lot of African Americans. We have a large African American population there. And yes, there are disparities. There's disparities as to who has medical insurance. And then even if you have medical insurance, it's a disparity in what type of treatment and therapy you may or may not get. So there are definitely different disparities that we have in health in our country today.
As far as Dr. Branch, health insurance, those who need it and those who have it and don't use it. What is the issue with that?
Well, the fact of the matter is that I believe that everyone needs health insurance, because we need health insurance at least for preventative type things. You need health insurance if you're going to have immunizations. You need health insurance if you're going to have like a colonoscopy for people who need that. If a person needs a chest X-ray for some reason. So I think everyone needs health insurance. Health insurance is not just for a catastrophic event in your life. Health insurance is for you to go, get some preventive care done, and then if you actually get very, very ill, then obviously you're going to need it. So I think that health insurance is for everyone. We all really need that health insurance. I think a shame is the fact that some people choose, for different reasons, that they won't get the health insurance because they need the monies for other things. And so I think that that's a concern. And then for a lot of people, a lot of working people, they don't have health insurance. Their employer, which may be a very small employer, does not offer health insurance. So there are many people, millions of people in this country who go out to work every day. But when they go to their job does not provide them with health insurance.
Just recently, the Maryland Health Initiative Association, I think I'm saying the right title, they announced an initiative to gain more health insurance for Maryland residents, collaborating with small business owners, collaborating with the faith leaders of Christian leaders and so forth, trying to bring in the health insurance. But it's a lot of issues with that, as far as where does the money come from?
The problem is it's money, and also, as we know that there are many things that money, you need money to actually do. I think that what we have to remember is we have to remember that we can't purchase everything in life, and this goes true for your personal life and mine. However, there are certain things we're going to have to put forth front and center. So in our personal lives, we have to say to ourselves, you know what, I need some health insurance. And so if there's any possibility, any way that you can get that health insurance, from a personal perspective, you should do that. Don't put it off to the back burner. And I think we as a country, we've got to say to ourselves, what is important to us? Education is obviously important to us. Having a sound economy is obviously important to us. We need to be able to start saying that health care is important to us, especially from a preventative perspective. We could save so much money if we would put funding towards the prevention of many of these illnesses and really block out some of the things that we're doing that are not good. And then I think we can actually save money in the long run. Unfortunately, in this country, many people may not have insurance, but if everything's going okay and they have no medical problems, we're okay with that. But as soon as that person has a catastrophic illness, now we want to take care of that person. But many a times, We could have prevented that if we had gotten some preventative care. And that would have been able to save millions and millions and millions of dollars if we could just prevent many of the diseases that we have.
What about for those who are unemployed, who say, okay, I don't have an option of getting health insurance from my employers? What do they do?
Well, you know, it's interesting because in Baltimore County we have a partnership program for folks who, where we partner with Kaiser, and for folks who don't have insurance, and if they meet a certain criteria from a financial perspective, Kaiser's actually giving them insurance for up to 3 years that they're not paying for. There are federally qualified health centers in the Baltimore and DC area, some being Baltimore Medical Center, some being Total Health Care, Chase Braxton. These are different places that you can actually acquire health care for a very, very, very reasonable cost. I think that people should contact their local health departments to find out, okay, what is out there? I don't have any insurance. I really would like to get some insurance. But what is out there for me so that I can actually get some of these preventive therapies and treatments that I need?
So I'll call to the Baltimore County Health Department and say, okay, I need health insurance. I don't have any health insurance. What does this health insurance cover? Do it cover dental? What about if I need surgery? What does this cover exactly?
Well, different ones cover different things, and it depends on your diagnosis and what program that you get into and what program that you qualify for. I could not list every one of those down, but I always say call, and then we can explain it to you. For example, the partnership program with Kaiser that we have covers full insurance for a person, irrespective of what they need. But then I have programs for specific cancers that can potentially look for the screening process for colon cancer or the screening process for breast cancer. And if you are diagnosed with those cancers, then we're able to assist you and help you with some type of insurance to get the treatment for those types of things. So we do have different programs. If a person has, let's just say, high blood pressure or diabetes, there's a PAC program with the state that may work, primary adult care program, that may work very well for them. We'll help them in the system trying to get onto that. Or if a person may just need some outpatient care, we can potentially go to a federally qualified health center to be able to get your blood pressure checked and your sugar checked and things like that. So in actuality, what we find is the fact that there are a lot of programs out there, but you have to look for them. You got to make it a priority in your life to look for where those health benefits are.
Thank you for your time, Dr. Branch.
Thank you, Bobby.
Again, you've been watching He Voices. I'm your host, the People's Pen, Bobby Marvin.